Thank you very much.
We will have a panel discussion on this year's theme, Hospitals are more than just patient care, the need for qualified hospital administrators. Requesting our first panelist, Dr. D K Shama sir, on the dais. Sir is the Medical Superintendent of AIIMS, New Delhi. Calling up our next panelist, Dr. Professor D P Saraswat sir, on the dais. Sir is the Senior Consultant, Medicine Health Management Services. Sir is the Professor and former HOD, Department of Hospital Administration at Kasturba Medical College, Manipal University. Sir is the COO and Medical Director of the Manipal Hospital, Bangalore. Inviting our next panelist on the dais, Dr. Yashpal Sharma sir. Sir is the President of Academy of Hospital Administration, India. Sir is the Managing Director, Jammu and Kashmir Medical Supplies Corporation Limited, with additional charge of Director, New Government Medical Colleges, Nursing and Paramedical Colleges, Jammu and Kashmir. Sir has worked as Mission Director, National Health Mission, Flagship Program, Jammu and Kashmir. Requesting our next panelist to come up on the dais, Major General Dr. Jagtar Singh sir. Sir is ex-Additional Director General Armed Forces Medical Services at Office of the DGAFMS, Ministry of Defense, and Commandant of Officers Training College, AMC Center and College, Lucknow. Sir is an expert in healthcare leadership, strategy, healthcare excellence, quality management, and hospital planning and designing. Requesting our next panelist to come up on the dais, Dr. Uma Nambiar. Ma'am is the CEO of Dalmia Healthcare Limited. Ma'am is the Managing Director of Zeden Life Sciences Private Limited. Requesting our next panelist to come up on the dais, Mrs. Nilanjana Mukherjee. Ma'am is the core team of strategy planning and business development of the hospital. Ma'am is the core committee member of Indian Chamber of Commerce, Odisha chapter in the Health Committee of ICC and CII. Ma'am is the State Secretary of AHPI, Association Healthcare Providers of India, Odisha chapter. Ma'am is the Unit Head and Vice President of Amri Hospital, Bhubaneswar. Requesting our next panelist, Dr. Sanjiv Singh, to come up on the dais. Sir is the Medical Director of Amrita Institute of Medical Sciences, Delhi NCR. Sir is the Chief Medical Superintendent at Amrita Institute of Medical Sciences, Kochi. The moderator for the panel will be Lieutenant General Dr. D Behera sir. Sir has retired from military services as HR. Sir has an expertise in strategic management, operations, HR, IT, project management. Sir is an NABH assessor. Sir is the MD of Kalinga Hospital, Bhubaneswar. So over to you, sir.
Good evening, ladies and gentlemen. I have to make a confession.
Sorry, sir. वो कैमरा बंद हो जाएगा.
Screen went off. As I was saying, I have to make a confession. My job has been made more difficult than a popular anchor who comes on prime time and asks questions to the panelists on behalf of the nation, doesn't let them answer it, sums it up, and concludes. And today I have been asked by the organizers not to ask any questions and conclude this session. And that is the problem we have with the time. However, given this distinguished panel of the panelists out there, it's my proud privilege to be moderating this session on a very important topic. Hospitals are more than just for patient care, need for qualified hospital administrators. While the panelists have been introduced, the mix also must be conveyed to the audience. We have doctors. We have also a non-doctor, and she comes in to eliminate the bias that the doctors will share in their views. We also have two clinicians. One of them converted into an early administrator who are on this panel, And being a military man, I can't help telling you that there are two paratroopers who are generally considered crazy to jump from that height of 30,000 feet. Right. Actually, I had planned to conduct this session in a very elaborate way, given the sensitivity and seriousness of the topic, and include the audience as well for some of my questions. But it's such that I'll have to curtail. People have to leave also. I come to a very crucial and critical question that haunts every hospital administrator. It is also a question that haunts our young students who are wanting to move on this path towards being administrators. My question is to Dr. D K Shama, who heads who's the medical student in AIIMS, who's been a teacher for many of the administrators out here, including me. Why is it, sir, that the hospital administrators have not been able to prove their essentiality like the other specialists, the clinical specialists, and that is why that there is no sort of sensitization of the bureaucracy or the decision makers to think that they are an essential commodity in the healthcare system, specifically in the hospitals. Where is it that our essentiality just doesn't come out, sir?
Well, first of all, let me talk about the essentiality part, that whether it is essential to have a qualified person at the helm of affairs in hospital management or not. Well, we should all agree that functioning of any organization, and that obviously includes the healthcare organizations as well, will be as good as its governance and management is. And in today's world, it need not be overemphasized that a qualified hospital administrator would be definitely essential to run the hospital administrative services in a much better way than a non-qualified person. And how that will be? That will be in two ways. That one, his qualification would have given him exposure about the basics of managing hospital services, be it clinical services, be it support services, utility services, and all. And second is that he would be available full time to manage the hospital administration. But the problem is that our number has been so small that we have not been able to make an impact. And second, the more practical issue is that the decisions are to be made at a higher level. Higher level means that those who are sitting at the top level in administrative cadre, be it the bureaucracy, be it our own clinical colleagues managing the administrative positions at the top. And I'd be frank to say that we have not been getting support from that level. And that is one of the reasons that our qualification has not been made essential in administrative position. It remains one of the qualifications. And since it is one of the qualifications, as was discussed yesterday also, people know that whether they have this qualification or any other qualification, they can still get to become the head of administration, be it medical superintendent, deputy medical superintendent, anything. So unless we get support from the top and this qualification is essential, it will be perhaps wherever we have been placed, we have proved our essentiality. But if the number is not in our favor, so that's why the difficulty.
I don't know, so somewhere I don't see that the corporate sector or the NGOs calling up the HOD of hospital administration in AIIMS, sir, how many guys are passing out this year? We would like to take them. That's not happening, sir. May I request Colonel Saraswat, sir, could you share your thoughts on this?
See, I tell you, the scenario is different in government sector versus private sector.
There is, sir, that is understood. But I was looking at...
So, obviously, the private sector has realized the importance of qualified, trained and qualified administrators requirement. And that is the reason that most of the CEOs or CEOs and administrators are qualified people. See, the point is that when I was doing the course, that was about 39, 40 years ago, when I was doing MHA. And trend that time, friends, were that people were going for the clinical specialties. And most of us who did not get any clinical specialty opted for hospital administration. That means the best of the brains or best of the hands did not come to this specialty in the initial stages. Though there are few exceptions, like I was the one, right? Then another thing is that the person must have had at the time of choosing people, because vacancies were there and there were few people who were takers, so everybody who wanted to join was allowed to join, who eventually came at the helm of affairs of their organizations. Many of them, the good administrator, effective administrator, had the capability to have the holistic understanding of healthcare scenario, healthcare industry, who could deep down into the industry and understand what is the requirement. And in recent times, it has proliferated that we were forced to understand that what is the medical practitioner or doctor's role and responsibility. More than that, what are the roles and responsibility of the paramedical staff? More than that, other non-medical and other than the district administrative authorities and the police, the way these epidemics have been handled. So for that, the people have distinguished themselves who had these capabilities, who learned administration in a classroom, practiced it, reread it, and further refine their skills.
Sir, I'll just like to take a view from the audience. Dr. Shama, I just wanted your, here is a middle rung administrator, that is the senior lot. Your views on this, how can we get ourselves more noticed, grabbed at?
Okay. See, having come out of a top-notch institute in the country and having served in both public and private sector, probably I can give you some insights and my understanding. I may not be entirely right. I somehow get a feeling that, what we actually do, a lot of work, more than we actually end up presenting. We do not demonstrate our presence to the extent that we should be felt essential, within quotes, to the system. Say, how many times we as administrators have helped in reducing cost for the hospital. We have done it probably, but we have not demonstrated it. How many times are we a part to a clinical governance assessments? How many times are we a part to looking at health technology assessment? So, or even if we are there, we are not demonstrating all the time. We are working probably, many of the occasions, that we are working probably as procurement officers and bid evaluation advisors to that extent. I don't think that many of us have stepped up ourselves as leaders. You have come from armed forces. You look at yourself, you have built up yourself to a leadership position. How many of hospital administrators have proven themselves? The entire armed corps is driven by hospital administrator, trained professionals. Even if you are from clinical side, you get a specialized training to be an administrator. So I think there is a need for doing some introspection there.
I get your point, ma'am. That brings me to, the point comes out that the corporate sector, the private health sector looks at the whole thing from a different perspective. My question is to Nilanjana ma'am. Ma'am, having been there in the senior executive position in many corporate hospitals, Apollo, Columbia Asia, now at the MRI, what is it that you look do you really require a hospital administrator? Honest answer, please.
Certainly, sir. We do require a hospital administrator, a trained hospital administrator. But hospital administration is not just limited to clinical acumen today. It is balancing between a good leadership between a clinical, non-clinical, and finance. So at the end of it, the person who is investing in your hospital also needs a financial outcome. So a good hospital administrator has to have knowledge of the three areas and balance it. And that has a lot to do with the leadership quality, because end of the day you are giving in service, and service, quantifying service is a very difficult thing. So as a private player, we really have to balance between clinical, non-clinical and finance.
Got your hint, ma'am. She's looking at, is he able to get me business? At the end of it, the corporate sector runs business units. They are in the business of healthcare, nothing wrong. Profits is no sin to have profits. But yes, the point that comes out is financial understanding, valuation skills are very essential that she requires in a hospital administrator. So in the senior position, possibly she's not looking at a hospital administrator, she's looking at someone who has had experience with these skills. I come to Dr. Sanjiv, a clinician turned now a reputed hospital administrator, very sought after resource faculty in hospital administration conferences. He also heads the largest hospital he's in a very senior position in the largest hospital in the no-profit sector. What are the positions that you're looking at? Now, he's not a trained hospital administrator, but he's much above many of us. What is it that you're looking, what positions in the corporate sector that you look the way you would think that a conventionally trained hospital administrator, as he is today, would fit into your scheme of things?
Basically, it is important that hospital administrator has to speak everybody's language. And I'll give you an example. When we did a Lean Six Sigma and we went to our leadership and we said that we are at 3.64. So he looked at me and he said that there is a patient at 3304. He is a relative of Chief Minister. See that there is no goof up this time. And I was really aghast that 3.64 after 6 to 8 months, no response. And I went back, did my homework, and went back to him after almost 4 or 5 months, and I said it is 3.64 and I have earned 3 crore of rupees. And he immediately got a seat for me. He has ordered a cappuccino with hazelnut. And I said, what can I do for you? So an administrator has to speak everybody's language. He has to speak the clinician's language, which generally don't do. I have seen this in NABH assessment. None of the assessor goes up to the neurosurgeon and asks questions, or a solid organ transplantation and asks questions, why did you do this?
Dr. Sanjiv, if I interrupt, do you have that advantage because you are from the clinician back with the clinician
Not really.
background?
I think so. It has to be that mix. And moment you get that mix, you get a clinical information, you start speaking to the nursing staff, you start getting in economics also, you have passion, you have bit of technology. It has to be a mix of everything. There is enough job. Right now, I am looking for many of them.
What position, sir?
All positions. I am not getting that mix because they either say that I was there in this hospital, I was doing a 30 CR of business and I went to this hospital and I did the 36 CR of business, so it is this language. Otherwise, they are reactive in nature. They say that they were doing the process re-engineering and they improved something and then that's it. So where is the model? Where is the tool application? So it is reactive. वहाँ पे कुछ हुआ, वहाँ कुछ करके आ गए. वहाँ भगे, वहाँ कुछ करके आ गए. But there is no framework. There is no ecosystem. There is no taking a step back, putting a culture in place so that things improve. So that doesn't exist. So moment you get good passionate, good trained, ready to ask questions, that why is always important, even to the management. Getting in economics, a wholesome person is lacking.
Excellent. That gives us a lot of insight into what needs to be now put into a curriculum. It's much more than what we have been handling. I'll come back to you, ma'am, Nilanjana ma'am. What is it you're looking at? What positions in your corporate hospital would you look at? Please also understand the range of hospital administrators is very different. We have those who have got MCI recognized qualification. We also have a huge bunch of, hospital administrators who may be non-MCI recognized qualification. All of us have to be there because the system needs all of us. There's not enough of us. So can you just sort of tell us where is it that people fit in what positions? Not necessarily, I just don't mean the present hospital. You would be heading many hospitals in the future. Where would you want your hospital administrators across with those kind of qualifications, MCI, non-MCI recognized?
I guess there is a huge scope of also certain non-clinical people to get into this line who have got the acumen of balancing between people. Why I would say balancing is you have a medical head in a hospital, you have a finance head in a hospital, you have store purchase, everybody in the hospital. Now the leader has to balance all these pillars of a hospital.
Does it mean that there is just one medical vertical where you need an administrator?
No. You need administrators, all these verticals, and to head this also you need an administrator. But today technical and hospital administration is something which is become very technical. Technical in the sense it is just not clinical or technical educative thing. It is lot of managerial skills, sir. Because today I saw the slide of Ayushman Bharat. You have packages which the government is floating. Your sustainability of the hospital is a problem. You as an administrator also has to decide your mix, your payer mix. You have to decide whether you'll pay with volume or you will play with quantity. So as coming back to your question, sir, today the courses have to be a little more vast and giving a perspective of more of a managerial and a leadership skill for a hospital administrator. That would ideally would be a very important thing. Like as Dr. Sanjiv said, very pertinent. You also have to deal with government. You also have to deal with union. You also have to deal with scrap selling. You also have to deal with biomedical waste disposal not on time. So that is all, entire thing is a gambit of things which you have to deal with. So that is what I would like to say.
Uma ma'am, you in this panel, a neurosurgeon, turned a hospital at a very rare mix.
Not so rare, I must tell you this. There are a number of them in the United States, and there is a...
Ma'am, I was not looking beyond perhaps. The borders,
yes. Okay.
Still rooted here. Just thought that it's a great thing because you, as a clinician like Dr. Sanjiv, you bring in great value to the administration when you come with your clinical perspective and your strengths, right. Which possibly the hospital administrator would lack, not having gone into the clinical specialities. And you've been heading many hospitals in India and Sri Lanka. That is how you went into the states environment. I just want your thoughts. Because there is this, that should it be a clinician administrator or should it be a trained hospital administrator? Because I find clinician administrators as well as good. So your thoughts on it, ma'am.
So, I mean, personally, it's been a great advantage to me because, you know, being a super specialist and an administrator, there isn't anybody in the hospital whom I cannot communicate with. And there is, I mean, I can befriend everyone, like right from teaching a housekeeping person how to, you know, use the scrubbing machine to speaking to all the super specialists and telling them why they don't need the equipment that they are asking me for. So it has been...
He can't talk back, ma'am.
So it's been a comfortable, you know, space in that sense. But the advantage is that many times, you know, when I was practicing as a clinician, and I've found that I could not make my administrators understand what I'm saying. But as a clinician administrator, it is, for me, I'm able to preempt what they are going to ask me. So I supply them or I give them whatever they want even before they have asked for it. So therefore, there is a much better understanding and a working relationship. And, you know, so it is quite smooth. I want to just, you know, mention here that we are talking about MD in hospital administration coming out of medical colleges. Vis-a-vis, our competition is MBAs in healthcare administration from business schools. It's extremely important that somebody is looking at a leader to head a hospital. They're looking at a business leader. They're not looking pure clinical.
Precisely, ma'am. It's a business
so
unit,
when
yes.
you have to do business leadership, it's an added advantage that you know the core domain which the business comes from, but you need to. I mean, I had to, besides my MBA, specially train myself for finance, for non-finance, just so that I can understand the language what the CFOs were talking. Okay, so we have to keep on looking at the business aspect. And that's clearly what the owners, promoters of the hospitals, the corporate organizations, they look at. And one of the things that I want is that when we are training people in MD in healthcare administration, please have a module for business leadership, for financial leadership. And why is it that our government hospitals do not focus on business? They should, in fact, start doing
because, ma'am,
focusing
there
on
is no
business.
focus in revenue.
No, we should. What I'm saying is we need to change, because at the end of the day, it's not that public
Absolutely.
hospitals don't cost anything. So we need to start looking as the public hospitals also as
Actually,
revenue
they are
centers.
more costlier
Yes,
per bed.
they are actually more
Yeah.
costlier. And that's when we will get a cross-sectoral, leadership which can, cross from public to private, and, we would be in that market. So that's, I think, we need to understand. And the other problem is when we get, leaders from business school, and no offense meant to people who are not from clinical backgrounds or not from healthcare backgrounds at all. I mean, you have people from the hotel background, from finance background, telecom background, coming as CEOs of large corporate chains. Why? Because there isn't anybody available who speaks the healthcare language and the business language with the same elan as they would speak. That's the thing.
Yashpal?
Allow me to just contribute one point here, corollary to what you have said. See, this was somewhere in 1988 or 89. The Medical Council of India assigned us a task to revise the curriculum for the MD hospital administration course.
Which year was it, sir?
This was 87 or 88.
How evolved was the corporate hospital sector, sir?
No. That time I was with Manipal University.
I said, how evolved was the corporate hospital sector that time, 1987?
No,
There's a
what
big
I'm saying,
difference.
I want to highlight is that because I had done a non-finance managers course from IIM Ahmedabad and also from IIM Bangalore. So I could speak that language and understand what they speak and what the connotation was. So with other people, I was the junior most in that committee, and I was strongly harping on the point that the finance management should be integral part of this program. But nobody agreed. I was thrashed and I was cut into pieces that what you are trying to do, and as a result, we administrator, by and large, I don't hesitate in saying, unless people have excel or made efforts to understand the financial management in hospital setting much better, most of us are not so good. Because the owners expect three things from us. That we should be financially viable, at least, and we are also responsible for the reputation of our institution. And third important thing is that what is our market share?
Yeah.
Now, our curriculum probably requires to relook at this.
Definitely. All that now boils down to how do we train ourselves. Yashpal sir, we have been saying qualified hospital administrator is the need of the hour. You think experience is a qualification, sir, for a senior positions? Not necessarily a structured degree?
I differ on that. Actually, formal training is always better, and you should be having formally trained people. And you must have seen that most of the government organizations are suffering just because of this, that the person who is at the helm of the affairs is the person who is the senior most. And the senior most person, whether it is medical education or it is, the health sector, senior most person is made director or made principal. Doesn't have any formal training or informal training also. I mean, in most of the states, you don't train them before you put them on a post.
There is no mid-career training.
No
Absolutely.
mid-career training. So they are committing a lot of blunders, and I don't think experience can only be a criteria. Formal training is very much required, and in the health sector, we were talking about the MHS and all. You have medical graduates and the non-medical graduates. There is some difference in them. And scope is vast. There's a lot of scope in the health sector as such as on today also. Because there are almost 70,000 to 80,000 institutions which require hospital administrators. And I was yesterday only telling that we hardly have only 15,000. And our medical institutions which are, have producing candidates every year, that's very less. As you talking about MCA recognized, if you talk about MCA and MCA recognized, there are only 100 or 125 candidates coming out every year. And altogether, maybe two times or three times. So scope is too much and we can accommodate, and it's not that we are not accommodating them. They are being accommodated in the health sector. If you see health sector, medical education, you get the people who come with the MCA recognized degrees as, professors, associate professors, they become like that. Then they come in as faculty. Whereas in the health sector or otherwise, you have many schemes. I have been heading NHM for 5 years. I have recruited many MBAs as program managers. So they have been doing wonderful job till now. Then now you have many new programs coming up, like you have National Digital Health Mission, National PMJY. In these all programs you have MBAs who are, although they don't have recognized degree by NMC, but their space is already there. So they are doing wonderful job. So altogether there's a lot of requirement of hospital administrators. Yes, clinicians coming up straight as administrator, that too is also.
So I see you drive home the point that structured training as a hospital administrator is definitely something that will strengthen the healthcare delivery system, because the hospitals form a component of that. And what comes out here is huge amount of changes that are required in the syllabus. I'll come to that a little later about the syllabus. But sir, given that its speciality has been there for now so many years, are there any thoughts about super specialization or sub-specialization in hospital administration? That is what comes out. I mean, if you're looking at leadership, you're looking at finance, is there a way that the hospital administration can go in for super specialization training? Any thoughts on that, sir?
Yeah, absolutely. Why not?
And have we done something, or?
No. Yes.
I don't know who's that we, but...
we in the Academy of Hospital Administration were trying to start the fellowship programs for, of some duration, like 6 months or 1 year. Like you can do it in material management, rightly pointed out, financial management, or any, branch you want. You can start in that. Like I have worked, whatever I got in my life.
Are you meaning executive development program, management programs, or are you meaning sort of equivalent to a DM or a postdoctoral diploma? I don't know what, sir. What exactly would the shape be of that kind of specialization?
We are in the process of making it, but it will be in the shape of, like you have super specialization. It will not be, like NMC recognized or something like that. But we will be trying to attach the candidates in the institutions where such branches are there. Like I was heading Medical Supplies Corporation for a pretty long time. I could have trained any hospital administrator there for 6 months who could have been called as a fellow or something like that. Or there are many other, institutions or our esteemed faculty members who are working in the various projects. Even the projects management can be one of the core areas. So these core areas need to be identified, and we can take help of Kotwal sir is here today, and even Srivastava sir is there. NHRC can be involved, and such areas can be identified in hospital administration also. That's not a big deal.
Now that you draw my attention to my dear friend Major Atul Kotwal, now the Executive Director at NHRC. General Kotwal, in a presentation earlier today, one of the speakers proposed a 5th cadre in the public health management cadre, a hospital management cadre. And if you recall the 2011 document of the expert group, high-level expert group on UHC, that it had said that, I think it was 2011, 19 also, that there should be a cadre of hospital administrators and hospital managers. This document of public health management cadre, I'm sure it has your touch in it. What are your thoughts on having a fifth cadre? While that document is not mandatory for the states, it is recommendatory and the states may adopt and tweak with it. The speaker said that not being a mandatory document, at least let it get pushed into that so that it brings out that there is a stream of hospital administrators that need to be absorbed in the system to improve the healthcare delivery, of which the hospital is an important component. Can I have a mic there, please? Mic, please. Where's the mic? Towards you.
No, thank you, sir. I was just enjoying the discussion. Extremely, excellent points are coming forth.
I hope it converts into something.
I think let's hope so. And that's how it starts, actually.
Yeah.
Thank you, sir, for this. Actually, the four streams actually are well known to everyone, all those who are present here. And the speaker would have definitely alluded to that. The teaching cadre, specialist cadre, public health cadre, and health management cadre. So health management cadre is the one which is all subsuming. It could be hospital administrators, it could be MBA finance, it could be BDS, Ayush with MPH or MHS, or even non-medicals with the qualification, or anyone with hospital administration. So that's the cadre which is basically having that. So having said that, the fifth one, I don't know whether or not we can create it, but then the flexibility has been given to states to work on it, and they can, but then few guiding principles have been given. There has to be a assured career progression within each.
Oh yes, the cadre management has to be done.
And the interstate change, seniority and all that have to be looked into.
And all those aspects.
Yes. So what, in fact, I'll also be presenting in, when I give my presentation, that we are now planning to hold an orientation workshop where we'll include the Academy of Hospital Administration and also various other stakeholders. We'll form a core group. Then these people can work with the states to see that these fructify. Because states need large amount of funds for this. What we are now trying to push to the states is to create sanctioned positions. Right now they are looking at NHM for the contractual position, 4.5 lakh over the last 15 years. But now it's time that state spending increases the 8% of the 8% per state. For that they have to create these sanctioned positions. So this fifth, what you mentioned, it's already there in the health management cadre.
It's not all that visible, it's there.
Okay.
Yeah.
So I think during that consultation we can again discuss about it.
Yes.
Thank you.
The issue now is that the syllabus needs a huge amount of modification. Can I have Professor Dr. Ram Mohan? Yeah, he's got a background of a corporate background, a hospital background, and now HOD. Sir, I'm looking at, is it possible for you to adjust between the curriculum? These are always very tightly packed. We want public health inputs in that. We want financial management inputs in that. We want all the other inputs that they said. Can we do it?
Sir, with due respect, the audience and teachers are here. We graduated in 98 from MD Hospital, being a medical graduate, MBBS from Nizams. We got the degree. We have all the whatever the discussions, hospital planning, health administration, including public health is there as a second paper MD. But I request, and also the public health component has to be focused. It has to make the focus. Second one is once we come out of the industry 20 years back, there are corporate hospitals, there are teaching institutes, medical colleges. Now over a period of 20 years, we have upgraded our knowledge to teach our students, but still we require it. I mean, there is always balance between
the point comes out that the faculty capability is being doubted.
Yes, sir. Faculty also has to upgrade our knowledge to, next generations has to make the challenge of what is to the expectation of society and community.
Sure.
Thank you, sir.
Sir, I'm being given subtle hints, but before I wind up, thank you, sir. Before I wind up, there's one point, sir, from General Jagtar, sir. How do you keep this discussion? How do we engage as the fraternity of hospital administration? How does it keep itself engaged with the policymakers, the decision makers, for them to see the specialty in more favorable light, rather than, sort of subsuming it into one of the cadres as General Atul brought out, sir. How do we keep this engaged? Because somewhere we are missing the bus, sir. We have not been able to influence, like Dr. D K Shama brought out, the policymakers and those decision makers have not been impressed with the capability of this cadre, sir. How do we get into this conversation, sir?
I think we at the Academy of Hospital Administration, which is like the National Association of Hospital Administrators, we are very conscious of this fact. And we have become acutely conscious of this fact in very recent times also during our discussions. And we are already working on it. The efforts have been that we have sought these kind of meetings and presentations with the who's who in the ministries, various ministries, and have met them and have expressed the kind of, the work which is required to be done in the hospital or can be done by the hospital administrators. Let me tell you also one thing, that as you mentioned in, in your presentation about that minutes of the Niti Aayog discussion, see this fact of acceptance that hospital managers are required for professional management of hospitals is very well with the government. They want it. But the idea is the capacity. The capacity building, they are talking about, please do something about building capacity for your specialization. We want more numbers. And if the numbers are not there, then we have to find ways and means to fill those positions in all the district hospitals, in all our sub-district hospitals and other, government hospitals. So they are looking at us to do something about it. And that is where we are engaging. We have already prepared papers for it, which some have already been discussed at the initial draft stage, have been put up to them, right? And the other effort that the AHA is making is, also engaging with the, associations or organizations like the NHSRC, right, where we have, signed a MOU with them, and they are also looking at us for building this capacity. Now, what have we done as a start?
How do you quickly build up
what
the
we have
capacity?
done? Yeah, I'll take a minute. What we have started is an extensive program of MDPs at least. Management development programs, we are conducting it for the states. We have already conducted it for certain states. I can name Uttarakhand
Is
and
it
JNK.
sort of standardized module that can be shared with other institutions to do the same
Yes,
thing?
we are ready
Sir?
to share it. There is nothing. And in fact, what I can share with you is the JNK, when Dr. Yashpal is there, they have, in that module, they have customized it for their own kind of requirements which they face in the states. So that has already been done. Second thing what we are looking at is we are in the process of discussion with certain IITs and certain IIMs to build these kind of programs which you alluded to, like into hospital supply chain management or into financial management. Small things, trying to build up these skills of the hospital administrators who are already in the job. So that is an effort we have started. Maybe it will grow up into something more, maybe a certificate, diploma, or a degree course, but we are onto it to, sort of build those, hospital administrators with a wholesome kind of a outlook at healthcare delivery systems. That is why I always feel, I've always said it in the Forge also, that a hospital administrator has to have the big picture and what his role is in that, big picture. Then only he can make a difference. Otherwise, if he just restricts himself, कि मैंने ये करना है, ये procurement करना है, इतना cost save करना, that will not get us the dividends which we want in the specialization. Thank you. That's what I want to say. Thank you so much.
Right, sir. I think that's a very heartening kind of comment to hear, that there is this engagement with the policymakers, and that they have realized, or rather, it's been there, that the importance of the hospital administration fraternity and the capacity building is going on. I would like to conclude this session, and I must thank the panelists for, I'm so honored to have chaired this, been the Arnab Goswami of this session.
Can I just add one point before you conclude? One of the things that, we are forgetting here is that when we teach our medical graduates, we just teach them patient care, and we don't tell them that there are so many other things besides patient care.
That
he leaves college.
Was there, but I'm getting my,
so they leave college and they don't know how to communicate to the patient. They don't know how to run their own clinic, and they don't know anything about how the place where they're working is run. So, and at some point, they also think that it's below their dignity to do anything other than patient care. I think this mindset needs to change. And we need to not only include this thing, but we need to make it aspirational at an undergraduate level, that you can be the CEO of a hospital if you do this.
Precisely, ma'am. Thank you so much. And I would like to thank the panel for, it was a pleasure conducting all. And may I request a round of applause to the excellent panel, and maybe to wake up those who took this opportunity to doze off. Thank you, ma'am. Audience. Thank you, organizers. Thanks.
D P Saraswat sir, Dr. D P Saraswat sir, to please come on the stage, and General Behera sir and Jawahar sir, Nilanjana madam, to please come on the stage for a small felicitation. Sir, sir.